Bismillahirrahmanirrahim. My affectionate students, Assalamu alaikum wa rahmatullah. Today I am going to discuss about Autacoids. Autacoids means self-remedy. Autos means self and coid means remedy. So the literary meaning of Autacoids is self-remedy. There are some substances which produce locally, and act locally, metabolize locally, and they are very important to maintain internal environment or body's homeostasis. These substances are considered as local hormone, and they are termed as Autacoids. Autacoids are of three types: maybe amines, maybe peptides, maybe lipids. Among the amines, histamine, 5-hydroxytryptamine or serotonin is very important. There are other amines like dopamine, noradrenaline, and adrenaline. Dopamine is considered as dopaminergic neurotransmitter. Noradrenaline is considered as adrenergic neurotransmitter, whereas adrenaline is considered as hormone as well as adrenergic neurotransmitters. Now, among the peptides, bradykinin, there are many substances: bradykinin, angiotensin, substance P, kallikrein, neurotensin, so many substances are. And among the lipids, prostaglandin, leukotrienes, and PAF, platelet activating factors. Now, these are the Autacoids. They are produced locally, usually not stored. They are produced on need-based. When there is need, they are produced, and they act locally and destroyed locally. Now, I am going to discuss important members of this group. Among the amines, histamine is very important substance, very important. Histos means tissue, and amine means substance containing H2 group. So amine, histamine means tissue amine. And histamine is a biogenic diamine. Histamine is produced from amino acid histidine, and it is metabolized by deamination and methylation. Histamine is present throughout the body, and its distribution is body epithelia, like gastrointestinal tract, respiratory tract, and skin. And in glands, uterine glands, they are gastric gland, intestinal gland, salivary gland, and lacrimal glands. And mast cells near the blood vessels. Now, in the epithelia, body epithelia, these substances are released due to invasion of foreign substance. In gut, it increases peristaltic movement. In respiratory tract, it increases, it causes bronchoconstriction. In skin, it causes itching, pruritus. In gland, it increases glandular secretion, it regulates glandular secretion, gastric secretion, intestinal secretion, salivation, and lacrimation. Very important role is played on stomach. It increases gastric secretion as well as increases HCl secretion. Histamine is a very important neurotransmitter for release of HCl. Now, mast cell near the blood vessels, they regulate microcirculation. Now, functions of histamine. It has got on a smooth muscle. It causes contraction of the smooth muscles of the body, but it relaxes arterioles, and as a result, it causes there is decrease in peripheral resistance and oozing of blood, increased capillary permeability, oozing of blood from the blood vessels, and lead to hypotension. Uh, Also, in smooth muscle, it causes in it is in smooth muscle. I mentioned that it causes contraction of the smooth muscles, except that of blood vessels, blood vessels, and in blood vessel, it leads to hypotension. In skin, it will cause pruritus and itching. Also, when there is a scratch on the skin, release of histamine will cause triple response of Lewis, that is flush, wheal, and axon reflex. Flush due to arterial dilatation, and wheal due to increased capillary permeability, and flare due to axon reflex, that is an antidromic reflex. Histamine is clinical use. It has got usually it has got no clinical use, but previously for certain purpose it was used for diagnostic value. That means in case of pheochromocytoma, which is a tumor of adrenal medulla, and it can be it is amenable to surgery. By removing the tumor, a patient will be all right. And this is the only secondary hypertension which is amenable to surgery. You know, histamine causes fall of blood pressure. But if histamine causes rise of blood pressure, then it will indicate that patient is suffering from pheochromocytoma. In pheochromocytoma, a tumor of adrenal medulla, and there is increased production of adrenaline, and which increases the activity of the heart and blood vessel, vasoconstriction, increased cardiac output, alpha and beta action, respectively, and rise of blood pressure. But will cause rise of blood pressure. Histamine is a drug which causes fall of blood pressure. But if histamine causes, instead of fall, it causes rise of blood pressure, then it is to be said that patient is suffering from pheochromocytoma. Also, it can be used for provocative tests, like in case bronchial, incipient bronchial asthma or subclinical bronchial asthma. If we use histamine, it can avert the case when the patient become clinically asthmatic. Similarly, in case of achlorhydria, it can be diagnosed whether this is true achlorhydria or false by giving histamine. So these are the diagnostic use of histamine, but it has got no other clinical use. And this diagnostic use are no longer practiced today. Now histamine, histamine is stored in muslin, mast cell, also in basophil. It is remain in bound form. When this histamine, there are some releases of histamine. Histamine releases are so many substances, including food, including coloring agent, dye, including proteolytic enzyme, venom, and drugs. Most important drugs is penicillin G, morphine, atropine, then bacitracin. These drugs will cause release of histamine. And now release of histamine, when there is excessive release of histamine, sudden excessive release of histamine will cause anaphylactic medical emergency, anaphylactic shock. And if there is small release, it may cause urticaria, rash, angiolytic edema. But sudden release of histamine in profuse amount will produce medical emergency, in which there is bronchoconstriction, increased bronchial secretion, airway obstruction, and increased capillary permeability, and oozing of blood from the increased arterial dilation, and oozing of blood from the capillaries, leading to hypovolemic hypotension, and due to bronchoconstriction there is respiratory difficulty. So it leads to cardiorespiratory arrest if not managed properly. Now histamine produces its effect by acting on receptor, and histaminergic receptors are H1 receptor, H2 receptor, H3 receptor. Mostly we concerned about H1 receptor and H2 receptors. And these receptors are G protein coupled receptors. Now the histamine antagonists. The action of the histamine can be antagonized by various ways. Number one is by physiological antagonism, that is by giving adrenaline. We can utilize this adrenaline in the treatment of anaphylactic shock. There is profuse release of adrenaline, profuse release of histamine, which causes bronchoconstriction and hypovolemic hypotension. This is due to action of histamine on histaminergic receptor. If we use in this medical emergency, the life-saving drug is adrenaline, and this adrenaline will cause bronchodilation and also causes vasoconstriction, arterial constriction, and increase cardiac activity. So maintains not only blood pressure, also maintains bronchodilation. Thus, it reverses the situation produced by histamine, which is termed as anaphylactic shock, a medical emergency. In this situation, histamine produces this effect, bronchial and vascular effect, by acting on histaminergic receptor, and they are agonists of histaminergic receptor. On the other hand, adrenaline, which produces double barrel action by acting on the bronchus, and that is adrenergic receptor, and by acting on the blood vessels, arteriole, that is on adrenergic receptor, and they are agonists. And here adrenaline is also agonist, histamine is also agonist, but the action is antagonistic. The action is opposite. One causes aggravates bronchoconstriction and fall of blood pressure. Another causes bronchodilation and rise of blood pressure. So in this situation, life-saving drug is adrenaline. This is physiological antagonism. Another way of antagonism is by inhibiting the release of histamine from the muscle, and this is done by nidochromyl sodium and disodium chromoglycate and by glucocorticoids. They will cause stabilization of the muscle membrane, so there will be no release of histamine, and the histaminergic effect will not occur. So it will not occur. So these are the blocking effect. And now there is another one is pharmacological antagonism. Here both the agonist and antagonist will act on the same receptor. One stimulates, one inhibits. Now pharmacological antagonists are H1 blocker and H2 blocker. H1 blockers, they are commonly used as anti-allergic, anti-anaphylactic, anti-pruritic, anti-emetic, anti-motion sickness, anti-Parkinsonian, anti-cough, anti-cold, anti-hiccup. These are the various uses of these drugs. Now, they are H1 blockers. It is again of two types. One is classical or older generation, another is newer generation. Older generations, the members of these are chlorpheniramine maleate, diphenhydramine, dibenhydrinate, promethazine, maclizine, cyclizine. These are the older drugs. And the older drugs, they will produce varying grade of sedative hypnotic effect. They will depress central nervous system of varying grade. And because they are more lipid soluble, they will cross blood-brain barrier easily and produce these effects. And they have got short half-life, so they have to be given frequently. Now, and they have got some disadvantages, and they have got atropine-like activity, and so it will produce some adverse effects will occur due to atropine. That is dryness of mouth, will be constipation. They may produce. and these drugs will produce central depression of varying grade. So it is very difficult for those who will handle automobiles or who will drive car, or students taking in the night time anti H1 blocker, older H1 blocker. They will not attend their class properly. They will cannot concentrate education because of drowsiness, sleepy tendency. So these are the hazards. The H1 blockers, classical, they will produce sedation, hypnosis, dizziness, then dryness of mouth. These problems will occur. So the newer H1 blockers are available. Members are cetirizine, loratadine, phenadine, fexofenadine, tarfenadine. These drugs are relatively have longer half-life. They are more water soluble. They cannot cross blood-brain barrier. So they have got no sedative hypnotic effect, and thereby they will not produce drowsiness or hangover or sleepy tendency. So these drugs and as they have got longer half-life, so single dose is enough to cover 24 hours, and they have got, so the patient's compliance is better. So the differences between older and newer anti-H1 blockers are: older are having a shorter half-life, increased frequency, frequently given, so patient's compliance is poor, and they will cross blood-brain barrier, producing sedative hypnotic effect. But the newer generation, they have got long half-life, they are more water soluble, they cannot cross blood-brain barrier, so there will be central difficulties, central hypnosis, these drowsiness, sedation, hypnosis, these will not be a problem. So these people can drive automobile in the morning while taking this by taking drug in early night. So these are preferred drug. But in case of children and in case of anti-Parkinson effect, H1 blockers, older drugs may be preferred according to situation. And for the students and for workers, those having held an automobile, for them the H2 classical newer newer antihistamines are preferred. Now these are the uses of histamine. Now there is now H2 blocker. These are very important. H2 blocker, they have got main effect on HCl secretion, gastric secretion, HCl secretion. They produce their vital effect in HCl secretion. This activity is this drug will produce hyperacidity, and there may be peptic ulceration occurs due to hyperacidity, and there is increased gastric secretion. So H2 blockers are used in case of hyperacidity, that is peptic ulcer, then Ellison syndrome, reflux esophagitis. In this situation, these drugs are used. Antihistamines are also used as pre-anesthetic medication. Both H1 blocker and H2 blocker used for this purpose. H2 blocker used for hyperacidity like peptic ulcer, Ellison syndrome, reflux esophagitis, as well as in case of pre-anesthetic medication to counter respiratory, to counter asphyxia, to counter it is used as in case of pre-anesthetic medication to counter aspiration pneumonia, which is due to HCl introduced into the respiratory tract. This is aspiration pneumonia, due to aspiration pneumonia. So this is more or less about histamine. Now the important is among the lipids, prostaglandin, and platelet activating factor and leukotrienes. Now these are also histamine has got a role in physiology, and also it has a pathological role, that is in inflammation. Important role in inflammation, and its more important role is allergic reaction. Allergic reaction occurs due to antigen-antibody involvement in response to histamine release. And also it is a powerful media for producing pain. So pathological role of histamine is, once again, pathological role of histamine is is allergic reaction leading to severe type 1 reaction and urticaria, rash, angiotic edema, to severe type 1 reaction is anaphylactic shock. And the another thing is in inflammation and in pain. And the other role, GI, maintenance of peristaltic movement, then microcirculation, regulation of the exocrine secretion. Now, lipids. Among the lipids, the prostaglandin, PAF, leukotrienes, they plays very important role. Now, prostaglandin, they plays important role in gastric protection, gastric mucosal protection. Also plays important role in kidney function, renal perfusion, and tubular reabsorption. Also plays role in coagulation and fibrinolysis. Also plays a role in maintenance of vascular tone and permeability. Also plays a role in temperature regulation. Also plays a role in pain regulation. Also plays a role in sleep and wake cycle, and also plays a role in uterus, where it performs ovulation, ovum transportation, zygote implantation, and labor. These are the physiological role placed by prostaglandin, and the pathological role is pain, production of pain, and the powerful media for producing inflammation. And it also, many diseases like bronchial asthma may provoke bronchial asthma, may also cause rheumatoid arthritis, and also it may cause Bartas syndrome, where there is hypokalemia, hyperinemia, hyperaldosteronism, but patient is normotensive. Now, these are the pathological and physical role of prostaglandin. Now, prostaglandin analogs are there, and they are used in clinical practice. And the analogs are dinoprost and dinoprostone. They induces labor and terminate pregnancy, including partial abortion or missed abortion, also hydatidiform for mole. They can be used as vaginal tablet, pessaries, and gel. Now, this is dinoprostone and dinoprost. Now, gimiprost, it causes therapeutic abortion, causes ripening and softness of the cervix. Then carboprost, used for PPH. Misoprostol, used in peptic ulcer as well as for therapeutic abortion. Latanoprost for glaucoma, that is increased intraocular pressure. Alprostadil, that is used in erectile dysfunction, and it also maintains the patency of ductus arteriosus. And ibuprostinol, they will produce vasodilatation. Now, these prostaglandins plays very important role in labor. There are some drugs which increases contraction of the uterus. They are known as oxytocics or egolics, and they are oxytocin, prostaglandin, argometrin, and quinine. Oxytocin present in our body, a hormone. Prostaglandin is a local hormone present in our body. Argometrin is a synthetic drug, ergot derivatives, though ergot is a natural substance obtained from claviceps alkaloid, and quinine is a natural substance. These are oxytocics or egolics. Similarly, there are some drugs which can cause relaxation of the myometrium, and they are known as tocolytics. Tocolytic drugs are adrenergic beta agonist, Rytodrine, then calcium channel blocker, and Maxal. Procolytics are used in case of threatened abortion or premature labor. Now, another important thing is migraine. Migraine is unilateral attack of unilateral attack of throbbing headache. It occurs in half hemisphere. There is intense throbbing headache associated with nausea, vomiting, and photophobia and phonophobia. What is the cause behind this is very difficult to say, but it may have central as well as peripheral component. In central, there is meningeal vessels will be dilated, and the nerves releases neuropeptide and also nociceptive peptides like CGRP, calcitonin gene related peptides, then histamine, high hydroxytryptamine, substance P, nitric oxide. These are the substances that will produce perivascular inflammation, spreading depression, leading to increased neuronal firing and produces throbbing headache. This migraine is a very disabling, troublesome disease. Though it is not life-threatening, but life is very unbearable during this situation. Patient cannot eat, cannot walk, cannot sleep, cannot move. There is an unbearable situation. There is vertigo, nausea, vomiting, photophobia, then phonophobia and photophobia. These things will occur. Now, treatment of this situation, along with general measures, drug can be used. There are two types. One is for acute attack, that is abortive treatment, and another one is preventive treatment, that is for preventive treatment. Now, for acute attack, there are two types of drugs. One is specific, another one is non-specific. Non-specific drugs are aspirin, paracetamol, and members of NSAID group like naproxen, ibuprofen, mefenamic acid. These drugs can be used along with antiemetics like domperidone, metoclopramide. And among the specific drugs are triptans like sumatriptan can be used, 5-HT agonist, and also drug in case of severe refractory case, drug may be used, argotamine. Argotamine can be used. Now this sumatriptans, very effective drug, 5-HT agonist, they produces cranial vasoconstriction and decreases release of vasoactive peptides and inhibits nociceptive neurotransmitter. That's in this way they will reduce the pain. Now, argotamine belongs to ergot alkaloids, synthetic drug. This is older drug, very effective drug, but nowadays no longer used unless resistant case. Because of this, because it causes vasoconstriction. Vasoconstriction, it may cause gangrene, which is known as ergotism, and it was known previously as St. Anthony's fire. Now the preventive measures, important drug is beta blockers, propranolol, metoprolol, then calcium channel blockers, verapamil, then tricyclic antidepressant drugs are amitriptyline, clonidine used. Also 5-HT antagonist, pizotifen, cyproheptadine, and methisergide can be used. And the newer drugs can be used as sodium valproate and topiramate, anti-epileptic drugs, sodium valproate and topiramate. Topiramate is very effective drug. It has got several ways, means to produce its effect by increasing GABA level, and also in gene related peptide, its level decreases. It also decreases sodium and calcium level, and decreases glutamate activity. Thereby, it produces prevents the migraine attack. So from this chapter, antihistamines are very important. Action of the prostaglandin physical role and its clinical analogs are very important, and the drugs for migraine therapy is very important. So please go through these topics very sincerely, honestly. They are very important not only for oral but also for viva, SAQ, MCQ. So with these things, I like to thank you. Thank you for your patient hearing. Assalamu alaikum wa rahmatullah.